Hello and welcome to the third educational series that is presented and provided by the Berks County Area Agency on Aging. Our third educational series is all about medications and seniors, and the various aspects that we will cover will be things about the medication programs and plans will be one of our segments. Another segment will be really talking about and with your physician about your medications, and a third will be talking with a pharmacist about the understanding of the over-the-counter medications, the prescription meds, herbal supplements, the safety of medications and its use, and some other things like storage and administration. My name is Barlet. I am the Public Advocacy and Outreach Manager for the Berks County Area Agency on Aging. And I'd like to welcome Dot Hartman with us, who's Vice President of Community Services with the Berks Encore. And Dot is here with us today to share information on the segment today on medications, programs, and plans for medications for seniors. So thanks and welcome, Dot. I know we have a lot that we can cover on today's show, so we'll get started talking right away about, I guess, really prescription medications specifically, and how we're going to talk about the various drug plans, Medicare, how do we go about enrolling, changing, all of those overwhelming things. So let's start right away with the basics in terms of the Medicare prescription drug plans. When do I get it and how do I get it and is it free? Okay.
Well, it can be free, but yeah, so for drug coverage, when you're eligible for Medicare, you would sign up for, you have to be on Medicare Part, at least Part A, to have any kind of prescription coverage. So you would do that at the point in time that either the month that you turn 65 is when you're first eligible, so you can do it then, or if you're still working or have coverage from a spouse that's working, you can do it when that coverage ends. So the first time you're eligible for it is the month that you turn 65, but you might delay that depending on what other coverage you have. And you can do that by signing up for what we call a standalone prescription drug plan, which is a plan that just covers drugs, and that would supplement your Medicare A and B. Or you can get drug coverage through a Medicare Advantage plan, and that would be when you're choosing to enroll in a PPO or an HMO.
In other words, a health insurance.
Right. Okay. They're called Medicare Advantage plans, okay. So you're using that instead of the original Medicare. You're using a Medicare Advantage plan where they have the doctor visits, the hospitals, and the drugs all in one plan. So there's two ways that you can get drug coverage, either in a standalone plan, okay, or in the Medicare Advantage plan. And just before we leave the topic of when do you sign up,
and how,
the first is your initial sign up, and then after that, every year you do have a chance to change or to sign up if you haven't. Okay. So Medicare has their annual enrollment time, which is October 15th to December 7th every year, year in and year out. So if you just want to change how you're getting drug coverage, or if you had not gotten it up until this point and now you want to start, you can sign up between October 15th and December 7th, and it will start January 1st. So it's always starting January 1st, and you have that 45-day window to get in or to change plans. If you didn't choose to get drug coverage when you first were eligible for Medicare, there is a penalty for not doing that. Drug coverage is considered, to be a benefit you should have. And so if you choose not to have drug coverage, and meaning that you didn't have it through an employer. I was
going to say, you don't mean
okay. Or you didn't have it through the veterans.
At all.
You just didn't have coverage because maybe you were just on generics, maybe you weren't on any drugs. So you're thinking, why do I need drug coverage? But because there is only once a year time to sign up, the thought is you should sign up at that time because you may not need it in January, but maybe in March you will. And you can't just sign up in March. So if you haven't signed up when you first were eligible, and when you're signing up, there's a 1% penalty fee for every month that you didn't have drug coverage.
And to clarify that, so let's give another example. If I, in the month that I turn 65, I'm still employed. So I still have drug coverage through my employer.
Right.
And time goes by and we hit that enrollment, the annual enrollment period, and I'm still employed and still have coverage, and I skip buy that because I don't need that. And we come to the next year in March or April, and for some reason I no longer hold my position. It might be, termination, layoff, whatever, I quit. So now at that point, let's say April, and we won't turn 66 until the next couple of months.
You can
What
sign up
happens?
then.
Can I sign up because I've lost my employment versus being hit with a penalty because
Right.
I might think I have to wait until that following open enrollment period, but I do not have to wait.
You don't. Yeah.
Okay.
Whenever you lose coverage through no fault of your own, or maybe you did decide to retire or whatever, but if you're losing your employer coverage, that is a special enrollment time for you, and you do have 63 days.
Okay.
63 days.
63.
To sign up. And like I said, coverage always starts the first of the month. So typically you're losing coverage at the end of the month.
Yes.
Every once in a while you hear people they stopped on February 10th and they're losing coverage February 10th. But Medicare plans always start the first of the month, so keep that in mind. But you can sign up. You have 63 days from the point in time of losing credible coverage to get into a plan.
Okay.
So the annual enrollment doesn't apply to you unless you're already in it or have neglected to sign up when you should have.
Okay. All righty. And I'm signing up how and through who?
The Medicare prescription drug plans, whether it's just a standalone plan or an Advantage plan, you sign up through Medicare. You can do it online yourself, www.medicare.gov. Berks Encore, as a prize counselors, we help people to do that. We basically just get online for you. We don't have a special sign up or anything, and we just use their website to help you sign up.
Okay.
There are probably insurance agents that would help as well, especially if you're going into an Advantage plan. Someone might be talking to you about selling a Medicare Advantage plan, so they can help. You can you can get on Medicare.gov, decide what plan you want, and then just call that company. So there's a lot of different ways.
Oh, okay. All right.
But it is something that you can do online yourself. Like I said, they're always going to assume you're going to start the first day of the following month. So if you know you don't need coverage until May, you have to at least wait until April 1st to go online and do it, because it'll have the plan start the first of the following month.
Okay. So you can't plan ahead. You shouldn't do it
you can
that far in
you can-
advance if you were planning that.
Right. You can look at the information, but you really
Kind of
can't
see what's
sign
out
up.
there. Okay.
Yeah.
All righty.
And we talked about, some people saying, well, I'm not on any drugs, so why should I sign up? But, the cost of the plans, there are some plans that are relatively inexpensive. And that changes every year, obviously. For 2016, there is a plan that's $18.40 a month. So for $18.40 a month, you can have prescription drug coverage. Maybe you don't need it now, but maybe you will next month.
And that might be just enough coverage for somebody in that situation where they don't currently take a regular prescription medicine, but may at some point. So
I mean, all of the plans have to cover drugs in every category.
Okay.
Obviously, the lower cost plans may not give you the best coverage for the most expensive drugs. But, people say to me, well, I don't know, what if I need a more expensive drug? Well, if you can tell me the name of the drug, I can tell you what plan you should choose, but obviously you can't. So, but picking a plan that covers what you need now is really the best advice I can give you, because there are, they have to cover everything. You can always ask for exceptions if you need a particular drug that isn't on the plan's formulary.
Okay.
Because you don't have the opportunity to change mid-year, the plans actually must give you an exception if your doctor writes a note saying, this is the only drug that does it, or they've tried these generics and they won't do it. So then the plans have to give you exceptions for the remainder of that year.
Good.
So it's really
so
not
hard
such a
to plan
scary.
ahead when you don't know what will happen to you.
Right,
To try and choose a particular plan that you think would benefit you, you can only do it at the state that you have, current
now.
health state, and not. Let's see, in 5 months, this might happen to me. So, okay, good. That's good to know.
And sometimes people think, they need a more expensive plan just so they have better coverage. It's not necessarily true. It's really, go with what you take now. The plan that's $18.40 a month, you can actually get your drugs for free if you use their mail order system. Okay. So the generic drugs. So you can still get some good deals with a low-cost plan. So you really just want to check it all out. Again, if you use Medicare.gov, you can put in your exact list, and it'll show you, what every plan that covers our area would cost you, what the copays are. So all the information is out there. It might
And then
be
you
a bit
receive
confusing.
that from them too. After you've selected that, you're still
Right.
going to get that that information as to
From the
what the
plan.
coverage is.
Yeah.
And like you said, and if you use our mail order, it would be
Right.
a zero cost. Things like that will be identified after you've enrolled, and you will receive that.
Correct.
Okay.
Correct.
All righty.
Yeah.
So the plans, I'm sure, as you said, can vary. You talked about the one that was $18 and change to a more.
Yeah, the most expensive one this year is $149.60 a month. So yeah, it's a pretty big range. And unfortunately, those most expensive plans aren't necessarily the lower copays. None of the plans cover everything during the coverage gap, which we'll get to in a little bit.
Okay.
So yeah, just don't go out there and pick the most expensive one. Let someone help you if you don't want to analyze it yourself. But that's how we can really assist people is helping them with the drug plan selection, because it's all about it. The information's all there. It's just understanding how to use the website to figure it out. Okay. And the other place where sometimes can be confusing for persons if they're using Medicare.gov and don't know exactly what to look for is that in the past couple years, the plans have really started to partner with preferred pharmacies, and that can really change the cost, what you're going to pay at the pharmacy. So you have the monthly premium, and then in most cases, you also have a cost when you pick up the drug or when you do mail order. And just by switching, from one pharmacy to another pharmacy can really save you a lot if there's preferred pharmacies. Again, this is all information available on Medicare.gov if you know where to look for it and how to get it. So, we kind of help people. We'll usually say, what pharmacy do you want to go to? And once they give us that answer, then we'll maybe pick another couple that we know tend to be preferred, just to compare.
Okay.
And it's always your choice. Maybe you'd rather spend $5 more and still go to the pharmacy where you know the pharmacist. And that's a choice. But at least what the trade-off is. So those are things that all can impact, how much you're going to pay for your medications and how you do that.
So you talked about also the money in terms of the preferred pharmacy. You said about mail order. Are there other ways of cost savings just in the regular plans that we're choosing? Is there anything else?
I would say that's the big one. The other thing that Medicare information does for you is it will show you alternative drugs. So if you're on a particular medication, it'll be a little note that says you can save money by switching to an alternative drug. Again, that might not be an option for you, but it might be.
Okay.
So that's information that comes up on the Medicare.gov screen. So.
Okay.
Yeah.
All righty. And then I think that you alluded to something about a gap.
Coverage gap. Yeah.
What do you mean a gap in coverage?
Yeah, for people that
So I'm spending money and I'm getting my plan, but now I don't. There's going to be a period of time that there's a gap in my coverage.
Yeah, it had been a real gap a few years ago. The Affordable Care Act is actually working to eliminate it so that there isn't any by the year 2020. But if you want to put the screen up, please, that shows the benefit parameters for Part D. There is, so there's a scale there, and not everyone will hit this. So if we start at the bottom, we're looking at you first getting drugs, and there's an arrow there that says deductible of $360. So some of the plans have a deductible. They don't all, but some of them do have a deductible. So during the deductible part, you're going to pay the full cost of the drug if your plan has one. So that's a place where you pay the full cost. Once you've met the deductible, then with most of the plans, the drugs that you get, you will then have to pay 25% of the cost, and the plan will pay 75%.
Okay.
And this is for generics and brands. Some of the plans do have generics for free, so that's not a hard and fast rule. Again, that's something where you want to use Medicare.gov to look at all your options. Then the gap comes. So when the cost of your drugs gets to $3,300.10, and that's not what you've paid, but that's the full cost of your medications. If as you go through the year, they add up and they've hit that $3,310 limit, then the percentages change. So once you've hit that cost limit, your generics, you're going to pay 58% of that cost, and the plan's going to pay 42%. For brands, you're going to pay 45%. and the plan will pay 50, and then the manufacturer discount will pay 50, and the plan will pay 5. So during that time, you've been paying 25% for your brand. Now it's going to switch to 45%.
Yes.
Now each year, that 45% will come down. So next year, in 2017, I think it comes down to 40%. By 2020, it'll be the 25%. So the gap is going to go away little by little.
Okay.
But that's what the gap is. And
so that is only good for another few years.
Yeah, 4 years. It's hard. It's hard to believe we're almost at 2020. How did we get there?
Yeah.
So, and then if you do, and well, some people do. There is a catastrophic thing where then you only pay 5%, but that's when
that's
the
when
total
you've
cost
reached
has got
that
to
amount,
the 7,000.
the 7,062.
And that's a combination of what you've paid and what the plan has paid. So. Typically, people, if people have expensive drugs and a lot of drugs, they can get in and out of the gap in within the year. And usually, those people, their total out of pocket's around $5,000, for the year, just with everything added in. So, it is, drugs are not cheap, as we know.
Right.
So that's a huge thing. Sometimes it's referred to as a donut hole, just in case someone heard that.
Okay.
That was kind of one of the initial terms that came out.
Yes.
But yeah, that's a coverage gap. And that's where obviously people, get hit. They start not getting their medications every month. They start splitting their pills. We advise people to maybe ask their doctors.
I was just going to say, talk to your physician if depending on the medication that you're on, if it can be switched from at least a brand to a generic might help, or some other situations that might help with the cost.
There are some financial programs, and we'll get into those next, that do help. If we can go to the next slide, there's a state program as well as some federal programs. So the first one that we'll talk, the first one, and it covers the first two lines, is PaceNet and PACE. So this is assistance that's available through the state of Pennsylvania, actually funded through the lottery. But you apply for the program really at any point in time.
Okay, I was going to say, so life circumstances could occur, and you could be on, just what we talked about, on your employer for a little longer than you took the drug plan that you needed, and now several years later, change in income, change in status.
Right.
So you can apply for these assistance programs at any time that you should qualify,
Correct.
right?
So there's no annual enrollment or anything like that.
Okay.
Now, for the PACE and PaceNet, you do have to be 65. So, there are some people that are on Medicare because of being on Social Security disability prior to that, but you do have to be 65.
Okay.
You apply. PACE and PaceNet is really like a secondary coverage. So you still want to try to have your drug plan, and then what PACE and PaceNet does is says that you will never pay more than, if you're eligible for PACE, more than $8 for a generic drug or $15 for a brand name drug. So that cap on the brand name drug is the huge thing.
Yes.
Especially even before you get to the coverage gap, your brand name might be costing you $40 a month. And then you're in the coverage gap and it's more like $150. So having that $15 cap, all year long is what really helps people save money. The PaceNet income limit is a little higher. There, for if you're single, you can make up to $23,500 for the year. If you're a couple, it's $31,500. If you're under that, as a single, if you're under $14,500, you apply for PACE, and as a couple, it's $17,700. So what that means is PACE is going to cost you less. For your co-pays, it'll be $6 or $9. So because your income's a little lower, you get a little more benefit.
Okay.
If you're on PACE, they also actually pay for the cost of the prescription plan. So your monthly premium will be covered.
Okay.
And with PaceNet, you would pay for that. You would still pay for the monthly premium. So great program. You can apply online. You can call over the phone. You get usually qualified within 7 to 10 days. You actually get an extra card, and you take that into the pharmacy and use it.
So now, before we move on beyond the PACE and PaceNet assistance programs, and you said that they're the secondary coverage. So, when do I recognize as an individual I've got some other coverage, and hey, I might be qualified for PACE or PaceNet, or I guess examples of where you've seen people who have maybe missed out on the opportunity to get PACE or PaceNet because either they didn't know or they thought, well, I have the other coverage and I just keep paying.
Yeah, either they don't know, or they haven't maybe had any expensive medications,
Okay.
so there hasn't been a real
Alright.
need.
Okay.
But yeah, it's often just this, hey, this is too expensive, what can I do? And then
Okay.
hopefully talking to the right person that will know. Doctors' offices should be able to tell patients about
Oh,
it.
okay, good.
Sometimes pharmacies might, when people get their taxes done, through the VITA program, I know at least, we're trained to ask them if they're aware of it, because obviously the tax return person is seeing your income.
Right.
So there's a couple different ways that we
So
try
I
to
just
get people
don't want
on.
them to keep paying. I'm sure there's so many stories of folks that have a different type of coverage, and they do keep paying that additional amount that we just talked about when truly, and they're trying to make ends meet, and as you said, that's when they start cutting back and truly might be qualified
Right.
for
They wouldn't have
PACE-Net.
to.
Okay.
Exactly.
All righty.
And then in the federal programs,
Yes.
if we can have that same slide put up again, there is a federal program. PACE and PACE-Net doesn't look at what you have in the bank. They just care about what your income is. The federal program does look at what they call resources. So that would be money
I
in the
see.
bank, CDs, stocks and bonds, not your house, not your car, but anything that would be considered an asset. So they do care about that. So you have to be under $13,640 as a single or $27,250 as a couple. And then you can see the income guidelines are kind of similar to PACE level. But if you qualify for that, your co-pays are even less. Your drug co-pays are $1.20 for generics and $3.60 for brands if you're at the lowest level. It could be $2.95 and $7.40, but you get the most help. They also, and that program does pay the cost of the prescription plan as well. So it is a nice help. It's all year long, no coverage gap for that.
Good. And then that's federal money, whereas
Correct.
PACE and PACE-Net are state dollars that
Right.
have been contributed. And again, you can help assist with any kind of application.
Right, yeah. The low-income subsidy is actually, you apply for that on the Social Security website, or by calling Berks Encore, obviously. Medicare doesn't help you apply, but they would refer you to that if you call with questions. But again, relatively easy and quick to get approved for that.
And I'm assuming I have to prove my status in terms of my income and any resources that I might have?
Well, both of those programs do have access to federal tax returns,
Okay.
so there is usually not much documentation required.
All right.
But yeah.
Good. All righty. And then I believe you wanted to share with us something that I think maybe people may not think about also, because I don't think in general some of the veterans think about definitely some of the general benefits that they have. I know, talking to some folks, they may not even realize benefits, and one of those would be some medication coverage.
right.
So can you tell us about that?
Yeah, I'm not, I don't work for the veterans, so I don't have a lot of information, but certainly depending on what, your years of service, where you served, you could be eligible for, if you're eligible for medical benefits, I think prescription benefits comes along with that. You do have to be seen by the Veteran Administration by a primary care doctor to order your medications through the Veterans Program, but they do also have nice lower copays for medications. I believe you can only get generics through them,
Okay.
but I think it's like $8 for 90 days for generic meds. So if you are a veteran and qualify for any the medical benefits through them, definitely ask about that if you
And it
haven't
certainly
done
is, again, another benefit that you've earned that you may qualify
Sure.
for, and it's out there. So you should call the Veterans Affairs Office locally here if you need that information. I can give that to you. You can call the Berks County Area Agency on Aging at 610-478-6500 for the Veterans Affairs Office number, or for Berks Encore's number in reference to the Apprise Health Insurance Counselors. For more on that. And last, I guess we have a few minutes to talk about another program, and please explain that one, a pharmaceutical assistance program, another.
Right, yeah. So if your income is too high for anything else that we've talked about, the last place you might want to try is the clearinghouse for pharmaceutical programs. So there's one number you can call, if you can put that slide up again. I think it was up a minute ago. Yeah. One number, and they will help you. They'll ask for your list of medications, and they will go out and see if there's any programs through the different pharmaceutical companies that make your drugs. that you might qualify for. And typically their income limits are higher. They're more like 65,000 or 75,000.
Right.
So income limits are higher. They're still income limits, but they are higher. And then usually you would get your doctor has to fill out the application with you, and they actually send the medications right to your doctor's office.
Oh.
So you're going to get it through your doctor. It's usually a year at a time that you get approved for it.
Oh, okay.
And it can, a lot of times it's free. So it can, again, be a great boost for persons that get caught in that coverage gap. So you can actually have prescription coverage. You can have a Medicare plan.
You can be paying for a plan that you have.
Right, but once you get in that coverage gap,
yes.
when the co-pays go so high, that's when you can use the pharmaceutical programs to assist you. So one of the questions is, do you have prescription coverage? And the answer is yes, but it's at the point, when you're in a coverage gap, you could still be paying quite a bit. So that's when those can kick in.
And and does this have an eligibility age as well?
No, actually those are any age.
Okay.
I think 18, you can be 18 or older. Yeah.
And I can enroll in any of these or call about any of these. I guess one of the things that I wanted to make sure is if the folks do know how to reach you. Mm-hmm. So why don't you tell us how to reach you at Berks Encore for those assistance and even discussing, sometimes we're just a little overwhelmed and trying to do some things ourselves.
Sure.
Or not reassured. So can you tell us how we can reach you and who we can talk to?
Right, yeah. So Berks Encore is 610-374-3195. Thank you for that. Extension 208 is the lady that handles calls and gets them to a prize counselor or sets an appointment for you. Sometimes it's something we can help over the phone. Sometimes it is we'll ask you to come in with a list of your drugs and go over things with you or help you do an application. But we can certainly help, and we're just want people to be aware that there is help, because a lot of times we get calls out of frustration, and here they've been paying for things or not taking drugs when they could have had help all along.
Right. I think that's also what we see at the Area Agency on Aging is folks that have been they've done well, they've gotten their coverage, and life has occurred, and they've continue on that same coverage with either not knowing about the annual open enrollment where I can look and can make a change, or they're just not quite sure that they trust themselves in looking at that and make a change, and to know that there's somebody that can sit with me and as I analyze that can talk me through a little bit about my questions that I might have, as well as knowing that at any time I can look at some of these other programs for medications and assistance and see if I qualify and review that. And I think that that's a wonderful thing, and I do want to encourage also folks to think about it and take advantage of the resources here in Berks County. So again, please call for those specifics to make appointments. Call Berks Encore, and Dot mentioned that number earlier, or please call our agency, the Berks County Area Agency on Aging, at 610-478-6500. We can help you with this, or again, make some of the referrals to other resources in our county. Well, certainly we had plenty to cover in this segment. Please tune in for our two other segments, all focusing on medications in seniors, when we talk with a physician about how to talk with your physician about medications, and maybe how to ask some of these questions as it relates to receiving a generic or brand and paying for it, as well as being able to talk with a pharmacist about that. So thanks for tuning in.